Welcome to the DoubleACS Daily News. Attleboro Sturdy Memorial Hospital is seeing a decline in COVID-19 hospitalizations. Chief Medical Officer Brian Patel spoke to us about the status of COVID-19 in the area and about vaccine booster shots.
My name is Brian Patel. I'm the Chief Medical Officer at Sturdy Memorial Hospital. We are definitely seeing a decrease in COVID volume right now, both in the community and at the hospital. As of this morning, we only have 5 COVID positive patients in the hospital, one of which is in the ICU, but thankfully not on a ventilator. So definitely much less than our peak a couple months ago when we had up to 25 patients in the hospital who were COVID positive. So we're definitely much better than we were a bit ago. For the hospital, we have started providing booster vaccinations for our employees. We're currently offering all 3 boosters, the Pfizer, Moderna, and Johnson & Johnson. And we've had a pretty good response with people getting their booster vaccination for all those varieties. So the booster vaccines are still indicated really for people who are at higher risk for getting severe COVID-19. So for Pfizer and Moderna, the recommendation is to get a booster vaccination once you are more than 6 months out from your initial vaccination series. And it's indicated for, like I said, higher risk people. So anyone who's over the age of 65, anyone who is over the age of 18 and has underlying medical conditions such as chronic lung disease, chronic heart disease, things like that. Anyone who's over the age of 18 and lives in a long-term care facility like a nursing home, because again, those close quarters put you at higher risk for spreading and getting COVID-19. And then lastly, anyone over the age of 18 who is working in a high-risk environment like a hospital. Anyone who received the initial Johnson & Johnson vaccine can get a booster once they're more than 2 months out from their initial shot. As of yesterday, they officially approved vaccination for children ages 5 to 11 for the Pfizer vaccine. Your children can go and get that as of this morning, and it's being offered multiple different places. The pharmacies like CVS and Walgreens are offering it. Various pediatrician offices are offering it as well. And it's you're eligible. Anyone in the age group of 5 to 11 is eligible for that vaccine. As you've seen over the past 2 years, we see these surges where the volume gets up significantly and then goes back down again as the virus kind of spreads and dies out and the transmission decreases. It's the nature of a viral disease. Vaccination is definitely helping. So when you look at the level of the spike that happens with each of these surges, it's getting less and less with each surge, and vaccination is playing a key role in reducing the height of each of the surges as we go through it. So vaccines are definitely an important role in reducing the incidence of COVID-19. You know, I think there are some exceptions to getting vaccinated, very few, but there are a few. And if you aren't vaccinated, you should still continue to have proper infection control. So wearing a mask, social distancing, hand washing, all of those things to reduce the risk of transmission of the virus and also to reduce the risk of you getting the virus from other people. So wearing a mask serves both purposes. There are always going to be some breakthrough cases of people who are vaccinated who get COVID-19. The important thing to remember is the patients that tend to get COVID-19 who are already vaccinated in general get much less severe disease. Their risk of getting hospitalized is significantly lower, and the risk of death is significantly lower. So if you look at the data in Massachusetts right now, the incidence of hospitalization and death in vaccinated patients is significantly less than 1%. It's a very small amount. So you may hear stories of people getting vaccinated and getting sick from COVID, but the overall data shows that the incidence of it is very, very low. And so vaccines are doing what they're supposed to do. No vaccine prevents getting disease 100%, but it does reduce the severity of getting a disease and the risk of having bad outcomes from the disease. And these vaccines have shown that to be true with COVID-19 as well. The CDC website is your best source. I mean, they provide the most accurate information. They provide the most up-to-date information. They provide information on data that's been released around the vaccines and recommendations and guidelines around how to manage COVID-19, vaccination, indications for boosters, how to stay safe, travel recommendations. So all of the information you need is on that website. And really, any information that's pulled from media outlets tends to be pulled from those websites. So go to the source, which is the CDC website.